can they do? Say, sleep in the stomach. Okay, if you sleep in your stomach, bad.
But okay, so if we go back to those 2 daytime postures, if I go back to that seated posture, all I need to do, if I take that exact same position and now put myself on the bed, gravity's now pulling in a different way. So it's pulling from the top leg down to the bottom leg, yeah? So if I stick an old pillow between my knees and ankles, anything from the supermarket, it doesn't have to be expensive. That's the other beauty of sleep posture. You don't really have to do anything other than not fall asleep like a wally. That's the clinical message of today's podcast, right?
Yeah.
So fill that space so the top leg's supported, that leg doesn't roll over like it normally does, because that's your preferred position.
Okay.
Yeah, that's thing one. Thing two is that the pillow has to fill that space. The neck is the most delicate part of the spine, yet we all sleep on the same size pillow. If you and your wife are on the same size pillow as your children, are you all wearing the same size shoes?
No one know.
Because that would be utter, like if you came home with a pair of shoes for your missus that were your size, brand new Gucci whatevers, she'd think you were mental. But if you went to the supermarket and bought 2 pillows, she'd be like, "Oh, I love the new pillow. Thank you very much." You either stand on something or you lie on something. That's generally what we tend to do on planet Earth. And we're spending the majority of our lives lying on something that either doesn't support us, which is essentially the second part of sleep posture. We can control the positions we fall asleep in. We make them neutral, on your back, on your side, but with the spine nice and straight. And then it's all around the surface. So if you're sleeping on, in the ocean on a lilo, you have to engage your core. You and I are nice and comfortable, and we can slouch, we can do these different positions because we've accepted our base of support. If I had no back, if this was a bar stool, my core would have to be engaged, right? Because I'm now less stable. So the same is true when you're asleep. If you move, then presumably your muscles have to engage, otherwise you just fall off the bed, right?
Yeah, I want to think. So, I mean, are there any studies out there to show? Because obviously we control our posture when we fall asleep. But what about when we're sleeping? It's all subconscious, right?
Exactly right.
If we fall asleep in a certain position, do we stay in a better position overnight? Or
so the principle is, the research that's currently out there states that lying in a provocative posture will increase your symptoms. There's not much that says not lying in a posture won't, as it's very difficult to prove that. But with everybody that we've ever worked with that's come to us as a stomach sleeper or as a side lier with both legs on the bed, or as a back lier with 15 pillows, or anything that kind of is really a world away from a neutral starting point, the body gets used to what we do. So your body's used to crossing one leg, and at such a young age, and we are able to suddenly stop being able to cross legs. You look like a fit, healthy guy, but yet, so imagine 20, 30 years time, the challenge of crossing a leg, or trying to lie on your right side if you've always fallen asleep on your left side. So it's a life's work posture, and we respect it so deeply in daytime. You can sue your boss if you don't have an ergonomic workstation provision, but you only work for 13 years, you sleep for 26, and sleep is the only time where you don't load your spine. You can have a really good support system. And I suppose what I learned in the NHS was that if you bring the bed to the patient, rather than allowing the patient to be sunk into the bed by gravity, then arguably they'll have a better posture. They can feel more support, much like swaddling a baby, which makes this the most simple intervention in global health. If you fall asleep in a neutral position on a surface that supports you properly, you're less likely to wake up in pain, and the comorbidity of poor sleep, which the number one reason for poor sleep is disturbance, and the comorbidity of pain, chronic pain being 1.78 billion people.
It's